We're going to look first at several objectives that we will be covering. The first of which is reviewing the federal regulations for investigator-initiated trials in the United States, including the sponsor and investigator responsibilities. We're going to be looking at the steps that are involved in starting up one of these types of trials, because we often have missing gaps in the startup phase. The planning part is very, very important, and many investigators are not sure what they've gotten themselves into when they go to conduct one of these types of trials. We'll also review the reporting requirements of the investigators in these kinds of trials. And again, that's where they usually fall apart, in that they're used to their role as an investigator, but they really often do not have an apprehension as to what the sponsor is doing for those kinds of studies normally that they're conducting. And in the investigator-initiated study, the investigator has to do both, the investigator reporting as well as the sponsor reporting. The third piece is to look at the essential documents that the sponsor investigator must keep. And this is extremely important in today's environment because the investigator must always be audit ready. In the current administration in the United States, we are seeing a lot of FDA inspectors appearing while the study is being conducted and not waiting until the study is completed before they go out and do inspections from a regulatory nature. So we want to make sure that the investigator in this type of trial remains audit ready at any point in time. We're also going to look at some of the ways that you could minimize the risks associated with this type of trial by avoiding some of the most common pitfalls that are associated with these trials. And lastly, we're going to look at some warning letters. Warning letters are those examples of regulatory deficiencies for which sponsor investigators have been cited by the regulatory authorities. And we certainly want to avoid that from happening in any of our sponsor-initiated studies.